glad to be here with you today. Today I'm going to talk about the influence of dimensions on primary stability and removal torque of short dental implants. As introduction, as you know, successful osseointegration has an important influence on the long-term success of dental implant restorations, while primary implant stability and osseointegration can be predictably achieved in dense bone. It's often challenging to achieve the same in areas with poor bone quality. Studies have demonstrated that initial implant stability is influenced by factors such as the length and diameter of the implant design, the micromorphology of the implant surface, the insertion technique, and the congruity between the implant and the surrounding bone. Low-density bone implant sites have been pointed out as the greatest potential risk factor for implant loss when working with standard bone drilling protocols. Clinical study with consecutively placed implants that were immediately loaded showed a higher failure rate in low-density bone, reinforcing that primary stability is a major determinant in the success of immediately loaded implants. Among these, resonance frequency analysis has been revealed and widely used as the most successful method to assess primary stability because of its easiness, accuracy, and non-invasiveness. The implant-bone interface is measured based by a resonance frequency, which is the reaction to oscillations exerted to the implant and is expressed as implant stability coefficient. On the other hand, mechanical tests such as insertion torque and values of push-out tests showed positive correlation to the primary stability. Hence, non-invasive measurement methods have also been introduced for diagnosis and prediction of immediate and long-term implant stability. Studies have shown that the measurement of removal torque strength was a useful indirect biomechanical method to evaluate the bone and implant interface. As objective, a preclinical trial done to compare and evaluate the primary stability and removal torque measurement of short dental implants in different dimensions. Materials and methods: fresh 6 years bouvet ribs from middle part of the rib procured from the butcher shop were used for the study. They were cut into 6 millimeter long pieces and 1 centimeter thickness, and a total of 20 bouvet rib blocks were prepared. The cortical bone was removed until it was about 1 millimeter thick in order to make it mimic to type 2 bone. 20 T5 implants manufactured by Nucleus in Izmir, Turkey, have used in the experiment. We classified into 2 sets. First one, 10 short implants with a diameter of 4.8 with 2 different lengths, 5 and 7 millimeter, were used to assess the resonance frequency and removal torque values. The second set, 10 short implants with a diameter of 6.2 with 2 different lengths, 5 and 7 millimeter, which were used for comparison. Resonance frequency: after installation, the ISQ was measured by using resonance frequency analyzer. The osteotomy sites were prepared according to the manufacturer's guidelines. After implant insertion, the magnetic wireless RF analyzer was used for direct measurement of the endosteous implant stability. The resonance frequency analysis technique analyzes the RF range, 100 to 10,000 of SmartBig, which can be attached to the implant. The probe of wireless analyzer was held perpendicular to the implant as indicated by the manufacturer. The removal torque value of each implant was measured using a digital torque MGT 50 digital torque gauge instrument. And the peak force measured at implant loosening was scored as the torque out value. We used analysis of variance, ANOVA. P-value less than 0.05 were assumed to be statistically significant. For the results, the mean values and standard deviations resonance frequency measurements are shown in this table. If you want to take a look. Implant showed ISQ values of 45.08 plus or minus 2.29 and 46.45 plus or minus 1.6 respectively for 5 and 7 millimeter respectively. For the 6.2 millimeter implants, the ISQ values were 50.5 plus or minus 105 and 51.57 plus or minus 2.06 respectively for 5 and 7 millimeters implants. This figure can help also to show the results up. Even though the values were higher for 7 millimeters in both groups, it was not significant. However, when it showed significant difference between the 4.8 millimeter and 6.2 millimeter diameter implants at both dimensions. The mean values and standard deviations of the removal torque measurements are shown in this table. The removal torque measurements showed no significant differences between 4.8 and 6.2 millimeter implants with 5 and 7 millimeter lengths. The removal torque values showed significant difference with the different diameter of the implants used. The 6.2 millimeter implants show significantly higher removal torque value compared to the 4.8 millimeter implants. Several critical factors are necessary for successful osseointegration of dental implants, including the primary stability and surface characteristics of the implant, anatomical conditions, the primary stability of the implant, which results from the initial interlocking between the alveolar bone and the body of the implant, affects the secondary stability of the implant because the later results from subsequent contact osteogenesis and bone remodeling. The stability of implants can be successfully assessed by the osteal device, which quantifies the resonance frequency. Resonance frequency is a non-invasive, objective method to evaluate implant stability, and it has been validated through in vitro and in vivo studies. The technique is based on the measurement of the resonance frequency of a small piezoelectric transducer attached to an implant or abutment. The primary determinants of the primary stability of an implant are the surgical technique used, design of the implant, and the mechanical properties of the bone tissue. Removal torque is defined as the amount of torque required to unscrew an implant from bone and is determined by the total degree of contact between the implant and surface of the bone. The greater removal torque values may be interpreted as the higher stability of the implants. Bovrib was used in this study and is classified as type 2 bone since it contains thick, compact bone and dense trabecular bone. So as conclusion, from the observed primary stability, it can be concluded that short implants were able to achieve desired primary stability in areas with good bone quality. The use of small diameter implants can prevent the need for bone reconstruction, like bone grafting or other augmentation procedures. From the observations of the study, it can be concluded that short implants were able to achieve desired primary stability, and primary stability substantially improved with short implants with wider diameter. These are the references. Thank you very much for your listening.